ओके भैया, थैंक यू भैया।
Hello. Yeah, yeah. Good evening. Yeah. So, who is the host?
Uh, a very good evening to everyone. It's a pleasure to have you all join us today for this significant and insightful webinar on a topic that concerns us all, drugs and substance abuse. As a part of the Indian Society for Technical Education, I, Devastiti Das, has taken pride in representing CASA, Say No to Drugs, initiative led by VIT University. Before we dive into this topic, I would like to extend a warm welcome to our esteemed speaker, Dr. Yasmine Ayesha. Dr. Ayesha is a general practitioner and a researcher. She is also certified in ACLS and BLS by American Heart Association. Her dedication to educating and creating awareness about the critical issues surrounding substance abuse has a profound impact on many lives. Dr. Ayesha, we are truly honored to
Yeah.
as a guest today. Your presence here is a testament to a commitment to the cause of preventing substance abuse and its devastating effects on individuals and society as a whole. We eagerly look forward to hearing your insights, which will undoubtedly shed light on this presenting issue. Without
Okay.
further ado, I would like to invite you to take the stage and share your expertise on the topic of substance abuse and drugs. Dr. Aisha, the virtual floor is yours, and we all are yours.
Okay. So, today's topic is on drug addiction and prevention. Just hold on. Am I echoing to you?
Yeah.
Yeah. How can you avoid it?
Hello.
Hello.
Yes.
Yeah. Can you avoid that? It's echoing.
Sorry.
It's echoing. The voice is echoing. Um. I'll rejoin. Echo ಆಯ್ತು. ನಿಮಿಷ. Hello. Yeah, hello, hello. Sorry for the interruption. Yeah, now there is no echo, right? Okay, okay, okay. Thank you so much. Yes, yes, you can. Okay, this is Anush, right? Who is speaking with me? Okay, okay, okay. So, how am I supposed to control the slide? Can you just keep on moving as I say? Okay. Next slide. Can you move? Yeah. Actually, drug addiction is a serious issue. What we are discussing here is how to prevent the drug addiction. Last session, I think I had given in the same engineering college, I discussed about the drug addiction. So this time I'll be concentrating more on how to prevent the drug addiction. So we have four C's, which when we talk about drug addiction, which is compulsion, cravings, consequences, and control. Next slide, please. So what is compulsion? Compulsion is the person will have very irresistible urge. It's like a control, it's like an OCD that they have to do that particular thing. So it's an overwhelming drive to behave in a certain way. So if they don't take alcohol, they'll have tremors, they'll have withdrawal effects. So they're compelled to take it. So someone with an addiction is overpowered by the urge to find and use drugs. And this type of behavior is described as compulsive drug seeking. Next slide. So cravings. Cravings are normal humans have cravings towards food and water. But apart from it, cravings, if it is there for drugs, then it comes to drug addiction. Mimic physical needs. So this, what it causes is, in the long run, it causes loss of sleep and lack of appetite. So that particular person, they will be like, if they don't take heroin or if they don't take any kind of drugs, they won't be able to sleep. They won't be able to concentrate on day-to-day activities. So they will crave for it. So that's called cravings. Let's move on to the another scene. Can you go? Yeah, the consequences. The consequences is the bad part. It will take a toll over the health, physical health, mental health. Financially, it will have a toll. Socially, it will affect, and it will have a toll over the professional health too. Physical means what? The body, the entire body. The person will not eat, he will not sleep well, he will not take nutritious food. As a result, what happens is that the person will become very thin and the person becomes more malnourished, that he'll be affected by many diseases, like anything can affect him. And mentally, if you see, they are more prone to diseases like schizophrenia, bipolar disorder, borderline disorder, obsessive compulsive disorders. You might find these disorders to be fancy name, as I'll tell you in simple words. They will be having mental illnesses, like they will see things which aren't present. They will have compulsive behaviors, like they'll do repetitive stuff. They'll have outbursts of anger, like in major depressive disorder. So mentally it will have toll. And financially, meaning they cannot be able to work well. They will not be able to have a job sustenance. So they will not be able to have a financial security. And social is, if they are withdrawn from others, they won't be able to mingle with others because all the time they are in drugs. So they won't be able to mingle with others. So socially also it will take toll. And professional health also. They cannot be very well sustained in a profession. There will be lot of absentees, etc. Next slide, please. Yeah. So as soon as the days progress, as the addiction progresses, what happens is that the drug takes control over the brain. When it takes control over the brain, we act like puppets. The person becomes a slave to the drug. So this is the last stage. So Anush, next three slides, please go on now, slow by slow. Just think what it is. Next slide. So the last three slides, how were it? Anyone can talk? Is it interactive session? Okay, so Anush, can you tell me what did you think of the last three images? You felt good, right?
Yes, ma'am. The last
It was about
images were
food.
of fast food, burgers,
Food,
pizza.
fast food. Exactly. It were of fast food. So I would like to tell, can you believe there is a connection between previous images and drugs action over? Can anyone believe it? I'll tell you how. Next slide, please. So this is how it works. Foods, especially good foods, very simple example I can tell you, chocolate. When we take chocolate, most of us are very happy. How? Why is it so? It acts on the brain and it causes this specific chemical to be released called dopamine. This point please take in mind because this point you will be able to link at the last of the presentation. So this dopamine is responsible for pleasure and happiness. So the person will be with full of pleasure and happiness. And the same effect is observed over the drugs also. What happens is that the drugs also acts on the brain, but here there's a change. There is a high level of dopamine, this extreme feeling of high. That's what they describe. People, whoever who take drugs, they'll feel high. It's nothing but happiness, but in an exponential stage. Next slide. So there are type of drugs. I would not like to go in detail because it's total of medical curriculum, but I'll tell in a crisp. Normally, drugs are in powder forms, in tablet forms, in inhalants. That is, they can be sniffed through nose, or they can be taken through arteries, veins. That is IV drugs. There are many forms, but among them, we have under the mechanism of action, we have three types like stimulants, depressants, and hallucinogens. In simpler words, I'll tell you a drug which is stimulating makes a person more active is called stimulant. A drug which causes a person to be less active, to go into a sleep mode is called depressant. And a drug which causes a person to see things which aren't even present or to hear things which aren't even there, or let's say a person imagines touching colors, that's what they describe patients. So those kind of drugs are said to be hallucinogenic. So stimulants, the most famous stimulant drug is, you might think it may be heroin, nicotine. Let me tell you, it is coffee and tea. They are the first caffeine drinks, followed by nicotine and cocaine. Depression, the most common one is alcohol and tranquilizers. And the most rampant one in nowadays is marijuana. Hallucinogenic, two examples, LSD and ecstasy. And most common one that is seen in all films they talk is magic mushrooms. Next slide, please. Okay, we cannot be talking about all the drugs. So let's take a common drug that is rampant in our society, alcohol. So alcohol has its effect, a very bad effect from head to toe. So if you're talking from brain aspect, the nervous system, then the person will be talking irrelevant things. They will be talking one topic, then they will switch on to other topic. They will not have a straight line of thinking. And whatever you ask them, their judgment quality is decreased. They won't be able to judge things properly. They won't be able to see things correctly. They have impaired vision, blurry vision, and their muscles are so weak they can't be able to take up a object. You can see mostly chronic alcoholics, they will have hand tremors, their hands will shiver, they won't be able to pick up a glass, they won't be able to do day to day activities, and their memory is very bad. Sorry, next slide please. So alcohol affects the body. Among it, the one organ that it affects a lot is liver. What it does is Alcohol affects the liver, it depletes its natural proteins. And the liver is the major organ of the body. It's like the powerhouse. It produces good hormones, good proteins, etc. So if the liver is affected, then it will cause a lot of effects. Next slide. So this is one patient whose liver is affected. You can see the alcohol, it affects the liver and it causes the liver to shrink. Cirrhosis means shrinkage. So when the liver is shrinking, its functions are affected. So the person will have pot belly, that is a big belly with lot of muscles which are shrunk. So there are no normal muscles present, and their legs are all swollen. And in the most extreme case, next slide please, the person will be jaundiced. You can see how sad the person is looking. It's the most end stage, chronic liver failure. Next, next slide. So alcohol, apart from taking a toll over the liver, it also affects the kidneys. Next, most important drug that is present in the country is nicotine. Nicotine that comes from tobacco plant. So nicotine is a substance that essentially causes lot of problems in the body, lot of cancers. Apart from that, a single cigarette also contains 4,000 other chemicals mentioned as in one name, umbrella term called tar, and that itself produces lot of cancer causing effects. Next slide, please. So these are the effects of the nicotine. You can see here from there are 6 pictures available here. It causes changes over the lungs. If you see the first right picture, there is a healthy lung and there is a non-healthy lung. The non-healthy lung is totally blackened. That much effect it causes. And below down the first image, it's about the oral cancer. And believe it or not, a mother who is an active smoker or is a passive smoker affects her child as well. The child which is supposed to be born at the end of ninth month gets born before itself. That's called premature labor. So the pregnant woman, when they smoke actively or passively, affects the child as well. Next slide. Sorry. And next important drug is marijuana, aka blunt, dope, ganga, grass, joint, name it whatever. This is the most rampant nowadays. It has become cool factor among college students, among school students. It's all become a fashion statement. I don't know. It's very rampant. But let me tell you the side effects. Let me tell you the toxic effects of marijuana. So what it causes, their effect is similar to alcohol, but along with it, they produce one of the most deleterious effect. That is, the person will have, next slide please. This is a very worst form of mental disorder called schizophrenia. In long-term patients using marijuana, what happens is that this disorder called schizophrenia happens. It means the person will hallucinate. They will see things. For example, let's say Arun is seeing things which aren't even there because he's been taking cannabis a lot. They hear things which aren't present. In certain cases, murderers who commit murders, they have told that they have been taking marijuana and they feel that somebody is giving them orders to commit murders. That they'll have, this is called auditory hallucinations. They'll hallucinate and they see things which aren't even there. And the other thing is delusion. What is a delusion? They believe is a false thought. Some people they become very paranoid, very anxious, that they believe somebody is following them, somebody has poisoned their food. This is called delusion. And then at the last stage, they'll become so odd, they'll maintain a particular posture, they'll become like a statue. Schizophrenia is a very dangerous mental disorder and it is observed in long term marijuana users. So be aware of that. Next. This is crystal meth. And I'd like to show you how they are looking. These all are effects of crystal meth. I would not like to go in detail because their information is similar to the past ones. But look at how they have changed. Whenever they use drugs, what happens is that their immune system also goes down. That is, their body's tendency to fight other infection also goes down. As a result, they become very malnourished, very weak, and they're very prone to other diseases. And this is what happens. And eventually, death follows. Next slide. So there are other form of drugs as well, and this is the most interesting part, inhalants. um, it's a very famous thing now that children, teens especially, they sniff tires, whiteners, spray paints, and other aerosols. Believe it or not, it is also a drug that causes high to them, but it's extremely toxic. For example, lead paints, if inhaled, can cause severe toxicity, even death. But they don't know. So drug addiction is not just pertaining to cocaine, heroin, crystal meth, marijuana, but there are other things like these things like inhalants, which are volatile substances. And one more thing is about the cocaine. Now, in case of stimulants, what happens is that I've already told you caffeine, nicotine, and all, they cause the person to be more active. But in other classification of drugs like cocaine, which causes more sleep, what happens is that not only it causes high in the patient, but it will have effect over the other bodily functions, like their respiration stops, they will not be able to breathe, they will not have good digestion. So sometimes the death may follow in overdose within hours. Next slide. So these are the other drugs as well. Next slide. So let's concentrate on one particular drug, alcohol, and how the treatment is being taken. First, whenever an alcoholism person comes, first we have to check the blood parameters. That is, do a blood test and see how the liver is functioning because the alcohol affects the liver primarily. So we have to see how the liver is functioning. Second is how the renal system is functioning, how the blood is, because after taking alcohol, the body becomes very malnourished, very ill, very weak. So you have to check how the blood amount, how it is, whether if there is an anemia, etc. So the first thing is abstaining alcohol. The person should not consume alcohol. The person should be in a strict abstinence. Then, whenever alcohol is abstained, the person will show withdrawal effects. What are withdrawal effects? They'll have anger, they'll have hallucination. Hallucination, as I've already told you, seeing things which aren't present, hearing things which aren't present. And the person will have tremors, and the person will not be able to sleep, and they'll be very violent. This is called withdrawal effects because the body will start to crave the alcohol that they had been taking chronically. So, to combat that, we will give medicines, for example, diazepines to calm them, to make them sleep properly. Apart from these modalities, extensive psychotherapy is needed. Psychotherapy meaning counseling. You have to make them encourage them not to drink, how to cope up the precipitating factors. Because if you ask many of the alcoholics why they are drinking, they will have many reasons. Some may tell that they are jobless, some may tell they have relationship problems. There are many problems. So just treating the alcoholism is not enough, but treating the root cause is more enough. Educating them about how to handle those precipitating factors in a healthy way is more important. So, not only the particular alcoholic person should be counseled, but the family as a holistic approach. And then you'll give medications to cancel the alcoholic effects over the brain. For example, the person is taking alcohol, but he should not feel high. So, to cancel out that high, medications are given. Next slide. So, next, this is where the dopamine link comes. I've already told you The dopamine is that hormone that makes one feel very happy, very pleasurable, and that is derived from fast food items, from sugars, from delicious chocolate, etc. Even by watching a movie, being happy with friends, etc. But if that high level of dopamine, very, very high level of dopamine is released in the brain by drugs, that is very, very bad. It will have negative effects over the one's own life. So how that can be prevented? By developing hobbies, by engaging in sports and socializing with good peers who motivate to abstain from drugs rather than encouraging drugs. This is a very hard point these days because most of them are into the drugs. So, socializing with good peers is most important. So, one should be always occupied with activities and engaging in social work and group works rather than staying alone, because when a person is alone they will think about what all are it's not needed, and making the brain rewarded with meaningful activities, releasing the healthy dopamine. Again, dopamine is the reward hormone. That reward hormone, whenever you accomplish something, will be secreted. So that should be produced in a healthy way rather than the drugs that cause very high level of dopamines in brain that makes instant high and causes damages. Next slide. So you can engage in sports. Some may like to watch sports, some may like MS Dhoni. So these are the things that people love. So do see things which are which affect you positively. Next, you have to do a lot of group works, be social, never isolate yourself, do social work, engage in more group activities like you have done today. It's a very good thing. Next, feeding others, helping out others, because in that way also you will feel very happy. Helping out others also gives you good reward hormone, dopamine. Next, spirituality. This is most important to fill the void. One can be spiritual in one's own way to fill the void and to not to go in bad way. Next. And always aim about achieving something, set goals and achieve something, because whenever you do that, be in academics, be in sports, be in anything, whenever you do it you will feel good, and whenever you feel good, good amount of dopamine is there, and when the brain gets used to it, it will not think about drugs and all. Next. So this is most important part. Should we taboo them? Should we stigmatize them? Yes, drug is a very bad thing, but it doesn't mean that blaming them is a solution. Never. You have to approach them with medical treatment, and there should be family and friends supportive, and repetitive encouragement should be there, because they'll be drinking again and again. But it doesn't mean you have to support that. But efficiently, you have to tackle the underlying problem of the alcoholics, that is whether they are jobless or whether they're having a relationship issue, that should be tackled by psychologists and should be treated by psychiatrists as well. Psychotherapy is the most important part, that is able to educate them how to deal with the negative aspects in the life in a healthy way rather than coping up with drugs, and they have to be always on close watch. Next. That's it. Thank you. Any other questions, please?
Thank you so much, ma'am, for enlightening this webinar with your insights. Our audience has asked various questions regarding the topic. Uh, so, I would like you to answer the following questions.
Okay,
The
sure.
first questions asked by the audience is, who are the individuals that require our utmost vigilant attention and care?
So this is a very tricky question. In this time, hello, Dobos Tuti.
Hello, ma'am.
So, at this point of time, almost everyone requires vigilance. But in them, the most important one are adolescents. teens who go to college, who go to schools, very important. And the another one is mentally ill patients, those who have schizophrenia, those who suffer from major depressive disorders, any kind of disorders, they tend to cope up with prescription pills. Not only what all I have said are drugs, anything that is not in moderation is also a drug, be it tea or be it coffee, anything. So prescription drugs, out of prescription drugs, if they are taking more of sleeping pills, these mentally ill patients, then that is also a problem. So family members should put a close watch on these patients. So, and socioeconomic status should also be seen. It's like a bipole. Lower the socioeconomic status, illiteracy rate will be more, joblessness will be more. So those people, there is they what they do, they'll recite they'll go to these bad habits. So that thing should be seen. And that's the most these are the most people who should be we should place vigilance on.
Yes, ma'am, I truly agree with you. Thank you for answering this. The next question put forward by the audience is could you please shed light on the psychological impact of substance abuse?
So substance abuse produces psychological effects mostly. That is, you can take it in simple words. If I would tell, they'll get withdrawn from everyone. They will not be social enough. They'll get withdrawn and they'll have psychosis. Psychosis is they will imagine things that aren't there. I've already told in the presentation of the PPT. They will imagine things that aren't there. They will hear things which aren't there. They'll be very angry. They'll be very violent. So that is called psychosis. And they won't be having good sleep, and they'll have anger issues. Some may even have self harm. So this should also be seen. And the most important ones are hallucination.
Thank you so much, ma'am. We actually appreciate your insights in this topic. So, moving on to the next question, what is the physical impact on the substance abuse?
Physical impacts I've already told about the alcohol. I've extensively told about it, how the alcohol causes the effects. Like it causes memory loss, it causes loss of vision. For example, not only the normal alcohol causes problems. Sometimes industrial workers, they drink spirit, industrial spirit, which is methanol, not ethanol. So that causes fatal issues. Person will die. What cause? And the person will lose their vision. So that things happen. And alcoholic liver disease also happens. That is liver failure, and the person will lose all their muscle. They'll get immunocompromised. They are more prone to other infections. So these are other effects.
Yes, thank you, ma'am, for explaining the physical impacts. Moving on to the next question, how can someone have the access to the support they need?
The first thing that they should be doing is confronting it. That is the first point. Confronting, accepting is the most point. There's no point in hiding it. Confronting to the guardians, if they are children, confronting to the parents. No matter what happens, they have to do it. Asking, seeking help. So it should come from them. And from our point of view, we should be also supervising those children, teens. So then, after doing that, they can go to government hospital or private hospital, enroll under psychiatry, and have an opinion. So psychologist as well as psychiatrist together will treat the patient. And there are national schemes as well, which provide financial aid to these patients in government sectors.
Yes, ma'am. Thank you so much. Moving on to the next question is whether the people should be blamed or actually they should be accepted, and if accepted, how they should be treated well.
So this is the common question. What happens is that people will be making comments that this particular person, like for example, Y, has got drinking problem. All he does is drinking. No matter how much we give advice to him, he will be the same. So this is what the people's comment will be there. So yeah, it's true, but this shouldn't be the approach totally. We should see into what's the problem. A person may drink because he has a mental problem. It'll be, it might be due to some brain chemical issues, or it might be due to family problems. So that should be addressed, and that root cause should be dealt with. That is possible by family members. As a holistic approach, they should seek psychotherapy from psychologists, and we should motivate those patients to recover. And the other myth I would tell is once a drug addict will always be a drug addict. That's not like that. With proper treatment, proper affection and care, anything is possible.
Yes, ma'am, I totally agree. Like, blaming is not the correct option. There should be some.
Blaming is yes,
Yeah,
exactly.
exactly, ma'am.
But
Uh,
it doesn't mean that we have to support them,
yes,
but
ma'am.
try to make them understand as much as possible without blaming them.
Yes, if help is possible, we should always provide. So the next question is like the what are the available medical treatments and interventions for those affected by substance abuse and addiction?
So affected by it, I've already mentioned in my PPT. It all depends upon the body condition. If the person is taking the drug, he has come to the hospital on his own will, or his on his intellect is intact. He has come with his parents or whoever it may be. He's willing to quit by himself. Then okay, it's not in an admission purpose. We might deduce from it. So in those patients, we can give them counseling, certain sleep medication, and try to tell him how to tackle the craving effects of the drug. That can be done. But in certain cases, like if you see alcohol, some patients will be, they'll be in denial. They won't be they won't be they will be in denial such a way that don't want the treatment itself. So when a patient is not does not want a treatment, that nothing can be done. So first we have to make them accept that you need the treatment. And even if some people are willing to come for the treatment, their body will not accept. Meaning, if the person is abstaining from the alcohol, maybe day one he will be all right. He'll be say, "Yeah, doctor, I'm doing good. See, I can do good." But that will always not be the same. As the hours tick, as the days tick, his withdrawal effects will kick in, which means his hands will start to shiver. He will become very violent. He's very aggressive. I've seen during my internship days that one of a patient who was normal the other day, he was chained the next day because he started beating others. That much craving effect he had, because without the alcohol, he became a monster. So the drugs should be given. So those kind of patients, you cannot tell, please refrain from alcohol, go to home, everything will be all right. Then it will be a big problem. Anything can happen. So those kind of patients should be admitted, and their blood investigation should be done. If there is a liver damage, then accordingly drugs should be given, liver protective agents should be given. And if they're having blood deficiencies like anemia, lower blood counts, hemoglobin, usually alcoholics have this, then they should be put on vitamin like thiamine and all. So it's a holistic approach. Next question.
Thank you so much, ma'am, for explaining this topic so precisely. Actually appreciate it. So the next question is on the screen, and it is like, are there any specific signs and systems that the family and friends should watch because they are the major part of our life?
Actually, this is the most important question out of all so far. What all questions he asked? The
Yes.
most important question, because in this time, in this period, everyone should be vigilant. I have already told you. The first question was, you asked me on whom we should be vigilant. I said you should be vigilant on everyone, because that's the case. If you are finding someone who is withdrawn, who is not socializing properly, who is not sleeping properly, who is not eating properly. This part called appetite is most important, not eating properly. Because what happens is that when the person is taking drug, his dopamine center will be activated. His brain will be so happy. He'll be like, I'm very happy with the drug itself. Why should I eat? Why should I sleep? Why should I do things which I loved before? The person would have loved sports before. But after taking drugs, the brain loves drugs more. So sports is nothing. So what is his previous activity will all not be there. There will be change in his behavior, change in his academics. So that should be seen. So sleep should be observed, appetite should be observed, his social characteristics should be observed, whether he's mingling with others or not, and his academic. If he's a child, if he's a college going student, then his academic should be looked upon. If a person is working, then any problem with the colleagues, or is he getting did he get fired or anything, that should be looked upon. If he's in a relationship, there are a lot of relationship issues, um, like um, some drug addicts, they'll face divorces and all. So that should be looked upon. So these are the major signs that should one look.
Yes, ma'am, I truly agree that family plays a vital role, and there should be someone to look after. So we'll go to the next questions. There are the common. What are the common misconceptions about addiction that need to be addressed?
I think I answered this. Misconception is that it cannot be treated. It definitely can be treated, and it's one's own fault. It is, but not always. The treatment is not. It's just not depends upon that particular patient. Never. It's never. It depends upon the family, environment, workplace. If it's a college, or if it's a school, peer pressure, someone is ragging the particular person. Everything should be seen. It's not a mistake of a particular person. That is never the case. And one more thing is, they think that a person with drug addiction, they are not fit to work. They're not fit to live. There's nothing like that. Proper treatment, anything is possible. Any other question? And
No,
one more
ma'am.
thing.
Yes, ma'am. Sure.
One more thing, that elderly people are also very stable, and they are not prone to drug addict. Not so. As I've already told, answer in your first question, that who should we place vigilance on? The answer is on everyone.
Yes, ma'am, I totally agree. Thank you so much, ma'am. I would like to extend a heartful vote of thanks to you for your willingness, for your insightful webinar. And your presentation today has not only broadened our understanding of substance abuse, but also it has inspired us to make a positive change and to understand our doubts. Thank you so much, ma'am. So,
Thank you.
take the knowledge gain and turn it into action for sure. Together, we can become a.
And
Yes, ma'am.
one more thing, in your college days, as your please look after your colleagues, your peers. If they are showing any kind of signs, then please take them to the concerned help psychologist, mentor, anyone. Try to help them. Thank you.
Yes, ma'am. Thank you so much, ma'am. Uh,
Thank you.
Thank you so much, ma'am. We can work towards a society that is better informed, more empathic. Uh, Thank you so much for the webinar.
Thank you.
And
Thank you.
I would request all the attendees to take a moment to fill our attendance sheet. You can find the attendance sheet in the chat box, and you can follow our in various social media handles. Stay tuned for our next events as we continue to bring valuable insights and discussion on important topics. Once again, thank you, Dr. Ayesha, for being our guiding light today. Your dedication to this cause is an inspiration to us all. All the
Thank
attendees
you.
are also requested to fill the feedback form. Stay
Thank you.
tuned for the next events. Thank you, ma'am.